1 in 5 young Nigerians have never tested for HIV, and this is rather sad in view of the fact that many young persons are sexually active. TVC News' Ivy Kanu tells us about the necessity of young persons taking HIV tests.
Young people aged 15 to 29 have the highest prevalence of HIV in Nigeria, yet most of them remain untested. A recent survey by the Nigerian AIDS Control Agency estimates that adolescents aged 10 to 19 years in Nigeria living with HIV is put at 160,000. There are fears the numbers may have risen due to lack of enlightenment programs. NACA also puts the prevalence at 4.2% for young people aged 15 to 24. But we asked young people if they have ever tested for HIV and how often they do.
Yes, absolutely.
When was that?
About 3 months ago.
Last time I went to the hospital, I checked and it was negative and it was okay.
I've not done it before. I've done HIV test before.
Yes, I've done it.
At this program are 13 groups consisting of 4 youths, each drawn from across the country. It is the very first HIV self-test kit program tagged Designathon. It is likened to pregnancy self-test kit. Each group was asked to brainstorm and come up with the most appropriate way it can be accepted by the youths. This is to drive innovation in the medical field.
Is a program, HIV services programming by adults and professionals like us, and often program designed by adults and experts are not youth friendly. So we decided to gather the youths to brainstorm and come up with a strategy that is accepted by youths, so that we're able to reach 90% of the youth who are living with HIV/AIDS.
Through HIV self-testing, many young people can pick up a kit in the privacy of their own homes, get to begin to know their status. Because what you find out with many young people is that they're not showing up in the clinics. We're saying, can they now be the solution? There is a problem, many of them are not testing, but can they offer the solution to ensure that they themselves and their fellow youths begin to test?
The message is clear. It is all about early detection. Prevent if negative or go for treatment if positive. Ivy Kanu, TVC News, Lagos.